Well, good morning, everybody. Welcome. For those of you who may not know me or my voice, I'm Colleen Fisher. I'm the newest Senior Development Manager at the Northern California, Oregon, and Washington office of the National Kidney Foundation. And we'd like to welcome all of you to our corporate coffee chat this morning. And I am going to turn it over to Amy Hewitt, our Executive Director, to let her talk to us a little bit about what we're going to be, what we can expect on today's call, and then we'll hear from some guest speakers here momentarily.
Good morning, everybody. Most of you I know, but for those that don't know me, I'm Amy Hewitt. I'm the Executive Director for National Kidney Foundation, serving Northern California, Oregon, and Washington. Thank you so much for joining us for our coffee chat this morning. This will be the first in a series of these that we're doing. Our next one's going to be a happy hour on September 16th. Again, just bringing everybody together. So much has changed since we met back in early March, and we just wanted to bring our key stakeholders together to reset, share a plan forward, and then inspire you to join us. And so today's inspiration is going to come from Dr. Hamoudi Albander. We'll also maybe get a couple words in from Doris, who's phenomenal, a transplant recipient and who works for us, and we adore her. And then get some inspiration from Reed Milnes and Colleen Fisher, who are both members of the NKF team. And I'm hoping by the end of our time together, you'll have all the details about this year's virtual walk and how you can get involved. And so I'm going to turn it over to Dr. Albander for a minute just to inspire us. Hey, Rob.
Okay, thank you. Good morning, everybody, and thank you for inviting me to be part of this wonderful group. You know, it's always, it's been a long 6 months since we met in March. At that time, we were very excited about moving in with the Kidney Walk and to support the Kidney Foundation. But then COVID came, which impacted our life at our level, as you know. Of course, at first, I like to say that I'm deeply honored to serve as a co-chair for the Kidney Walk for the East Bay. And I'm looking forward to do everything to help the Kidney Foundation. For the last 6 months, it's been quite challenging for the kidney community. I mean, if you think COVID impacted our life at all levels, our community and our patient has been impacted much, much more across the board. To begin with, any patient with a chronic kidney disease, whether on dialysis or not, are classified as a vulnerable population. And indeed, that's the case. Any patient with a chronic kidney disease who infected with the COVID virus, 46% of those patients ended up in the hospital, which is significant, highly significant. Significant number of these, almost 25% of them, ended up in the ICU. And if you go to the ICU, it carries much higher morbidity and mortality. The dialysis population, again, have a higher incidence of COVID, and it's a quite complex situation for them. On the other hand, patients who admitted to the hospital with severe COVID, almost, depending on the study, 10 to 50% of them ended up in the ICU and ended up requiring some kind of renal replacement therapy, which include either dialysis or continuous treatment. These are extremely ill patients, and they require and the dialysis process is a very complex because they clot their blood, et cetera, and carry a very high mortality. So across the board, our patient with a chronic kidney disease, so COVID not only impacted these patients at a more than the general public, patients also who are normal developing kidney disease from this terrible virus. So our community has been impacted. In Mount Sinai, you know, like 46% of the patients admitted to the hospital with COVID have some kind of kidney problem. These, of course, at this time, we do not know the long-term effect of COVID on the progression of kidney disease, whether there is cause of a new chronic, a new kidney disease. Therefore, the impact is huge on our community. And as I said in March, that we need the help to help our patient with kidney disease. Now is many order of magnitude, we need more help. And that is all the reason at this time to support the Kidney Foundation, because as I said, it's the only organization which is committed to help our patient and help the renal community. So I really encourage everybody to do their best to raise the fund and support the mission of the Kidney Foundation at this time. COVID is not going to disappear. It's going to be with us for a long time. We needed the help before, and now we need it much more. And I appreciate, as a nephrologist who treat these patients, we appreciate your help as much as you can. And thank you.
Thank you, Dr. Albander. That was, the facts are startling, and you know, you kind of put it very simply. We need your help now more than ever, and so thank you for sharing. Now I would love to hear from Doris Liu. She also spoke back when we all met together.
Join the meeting
In March, and would love to have her say a few words. I think, again, we're all at a very different place then, and now I think we're even more inspired than we were even before. So if you wouldn't mind just saying a few words, Doris. Oops, you're on mute.
Oh, so sorry. Yeah, no, thanks for that. You know, just thinking back on that last time we met in person, COVID was just beginning to happen. And so we were all kind of in a nervous place. We had some people who canceled because they were nervous about being out with other people. So here we are, and it just feels kind of surreal. My story was like many others, and in some ways better, because I was diagnosed with kidney disease probably when my kidney function was about 30 or so, far later than I think I should have been, but I'm finding out over time that people are being diagnosed far too late because kidney disease is a silent disease. You just don't feel it. You just get a little more tired, but there was no pain, no nausea, no nothing, no anything until you start to feel achy. And when I finally was diagnosed, after I was rejected for life insurance, that's when my doctor noticed that, well, maybe we'll just fix it with some blood pressure medication, and it didn't. Eventually I did a year of peritoneal dialysis and did eventually get a living kidney donor, and so I was very fortunate, but not without feeling when it's far too late. My kidney function was at about maybe 5% before I started feeling itching all over because of the phosphorus in my body, inability to be able to focus because of just the toxins in the brain, all that building up in the body. But I was fortunate, I got my kidney, and so now I'm advocating because I just feel like we are spending a lot of Medicare dollars on kidney disease, on dialysis and on transplant patients. But we really need to focus a lot more attention on kidney health and preventing this disease. And of course, now with COVID, I'm feeling pretty nervous because of these numbers that Dr. Albander just shared. So I'm really rarely out. I try to be very careful. So kidney disease is just a really, really huge problem. And so thank you for being here, and thank you for participating and urging people to walk and supporting the National Kidney Foundation.
Thank you, Doris. That was,
yeah.
It's always wonderful to hear from you. Okay, so do you want to get so this morning we're going to walk through, you know, what Kidney Walk is all about. But first, I just wanted to share, here's why we walk. It's really for the 37 million Americans living with chronic kidney disease, and for the nearly 100,000 awaiting transplant, and sadly those, who did not receive their transplant. So it's for all those reasons that why we walk. And then now, next slide, Colleen. And now in the time of COVID, as Dr. Albander illustrated, our community is even more at risk, not to mention those suffering from acute kidney injury, many who had no underlying health or kidney issues prior to the virus, and who are now requiring dialysis. And then as we walk into the fall season, many of you who were with us for the breakfast, we shared about the launch of our 33% campaign. So I'm excited. I'm excited that as we relaunch WALK, we are also relaunching the 33% campaign. And it's a public awareness campaign in partnership with the Health and Human Services and American Society of Nephrology. And it's going to shine a light on the fact that 1 in 3 Americans are living with CKD, and sadly, most don't know it. So that's going to be relaunching September 1st, and stay tuned. There's going to be a lot more information coming out about that, and we will share more in the follow-up email. And then next slide. I just wanted to share really quickly, here's where your support gets put to work. We are focused on prevention, patient and professional education, patient support, and public advocacy, which is the result of, the 33% campaign is a direct result of those advocacy efforts. And so I think that's where NKF is really making its mark, and we're gonna really help our patient community. Next, I'm going to turn it over to Colleen Fisher. She is the newest member of our team, and she's going to tell you a little bit more about what this year's virtual walk is going to look like. Take it away, Colleen.
It's so nice to be here. Really appreciate it. I really try to bring the energy to everything we do involving Kidney Walk. So it's absolutely fantastic to be here talking with all of you. So wanted to explain a little bit about our national campaign and how this all came about. So as COVID was hitting and as we were going through our spring events, we were realizing that we needed a new way to talk about Kidney Walk in a way that was virtual. And so it's a way, LaceUp came about as a way of our CEO, Kevin, the way he likes to describe it, Kevin Longino, he's like, I put on my shoes every day and I lace up and I get ready to go to work. Like that's how I approach work. So that's kind of where LaceUp came from. And the way I think about it as a community is those laces, that's what ties our community together, right? Like we're lacing up, we're tying ourselves together. We are so committed to wanting to create a better world for people with chronic kidney disease and acute kidney injury that we need to continue to connect ourselves together. And that's where LaceUp comes for me. And so it's going to be this campaign that you continue to see out throughout the coming months. And it just has a much deeper, more ingrained meaning and how we're all, like, again, like spider webs, like ways that we're all really connected together. So it's just a great way to think about our walk program and how important it is to our community. Just on an overall national view, we are looking to try to secure 37,000 walkers from all 50 states and the Washington, D.C. It's going to be new challenges and incentives this year. And as we get further along into our program this morning, you'll see all of those things rolled out. And we'll explain some of those in more detail. And then also we're going to have a local opening ceremony and activation. So we've got a regional kickoff happening in September. We have a online celebration ceremony that we're going to be partnering with our New York office on, which we're very excited. We'll explain more about that as well. So we're really looking at taking a virtual world that we're all living in and finding out all of the amazing ways to add fireworks and to continue to add that excitement and that engagement and not letting anything stop us. So it's very exciting. So I'm going to take this opportunity to turn it over to my colleague Reed and let him talk a little bit more about our local efforts, and then I will be hopping back on in a little bit with some more engagement ideas and opportunities for you.
Thanks so much, Colleen. Really appreciate it. Thank you, everybody. Yeah, along with the excitement at the national level, we have a lot of really exciting elements that we're bringing to our regional event. Colleen, if you could hit the next slide. So our walk itself, virtual, in your neighborhood and everywhere where you're at, is on November 8th. We're really looking forward to the event. We've got a lot of folks, you know, across the seaboard, and again, we're working with the East Coast in New York, so it's going to be a fantastic event. We've got some great spots, obviously looking at our different regions, but all coming together simultaneously. So have you hit the next slide there, Colleen? So we've got the sites that you're traditionally used to with San Francisco, Silicon Valley, and the East Bay. We've added the Pacific Northwest this year. Wonderful to be able to expand our reach into Oregon, Washington, and beyond, quite honestly. That's the great thing about this virtual platform, is that it really lets us reach every corner of the globe, which we're really trying to do, definitely. If we can have somebody from every single continent, Antarctica included, we're working on that. So it's going to be a lot of fun to bring everybody together. And on September 23rd, we have our regional kickoff. Definitely trying to bring the excitement, as Colleen mentioned. This is going to be a lot of fun. We're really going to get to an opportunity to celebrate why we're all here. Basically, come together as a community in the same way that we did walking, but you know, more obviously virtually. But really creating some opportunities like this and others to make sure that the community has a chance to stay connected, really build that excitement, and understand that we are all in this together, and that we've got so many partners who are helping support us through all of the things that we're enduring right now, including COVID. So we've got some big goals, 3,700 walkers for our region. We're looking to do 37 million steps. That may sound difficult, but actually it's very doable. I believe it's only a 10,000 step day for each walker. If my math is bad, I apologize, but I see Colleen nodding, which means my math was good. So really, you know, that's just what you do in one day. Or, you know, press it out and really go for that 20,000 and help us get there for folks who may not be, you know, able to hit that 10,000. But we're really looking to try and hit over $600,000 in our market goal here. Really important for all of the programs, all of the support that it provides for kidney patients, their families, and the community at large. So what will it look like? You know, I mentioned it's virtual. It's from wherever you are, your living room, your neighborhood. We're asking you to get out and engage where you're most comfortable. Obviously, you know, not everybody has open space at their availability. So if it's in your living room, wonderful. If it's in your backyard, that's great too. Really, any place that you're comfortable to get out and walk, bring your family, bring that small group of friends that you've been able to create a pod around. Just bring the excitement and get out there and share with your community what we're doing, because that's part of the importance of this walk, is sharing the message and making sure that we're connecting our work with the rest of everybody out there. Oh, we've got some, yeah, there we go. And we will be broadcasting our live ceremony, our opening ceremonies from Oracle Park. Lots of fun. We're going to get the Jumbotron going and lots of interaction there. So while everybody's doing their walk, they'll also have a great event to be able to engage and get that excitement either before or just after, depending on how ambitious they are to get those steps in that day. But definitely going to make sure that we've got yet another opportunity and a big culminating opportunity with some, if I might say, awesome bells and whistles to really make it an exciting day. So really looking forward to make sure that the community, kidney patients, families, everyone understands that the importance of this, but also has an opportunity to have some fun. We've all been sheltering in place, or to some extent that, and you know, it's nice to be able to get out and rub elbows, or at least get on Zoom and rub elbows with some new faces and friends. So as I mentioned, we are going coast to coast, East Coast, West Coast. New York is doing November 8th as well, so it creates some wonderful synergy. We are really trying to shall we say, get the bragging rights on this side, looking to have the most successful campaign that we can, because, you know, we are the best coast. It's not just the West Coast, it's the best coast, period. Just don't tell New York that. We can do that afterwards, because we'll definitely be at the lead of our campaign for sure. But this is a great opportunity for, you know, for everybody. It not only expands the visibility of the event, but also it expands the visibility of our corporate partners, sponsors, and everybody who is so generously supporting us. This creates an opportunity much larger than we've ever had before, where we can really bring identity and awareness of our partners and their work and the impact that they have, you know, to a much larger audience. So great opportunity as we are engaging folks, you know, whether it be in that fundraising or the fundraising side of things, really an opportunity to plus the value of that type of participation. So there are lots of different ways to get involved. Sponsorships, we talked a little bit about that. We'll talk a little bit about that here in just a second. Walk teams, obviously the goal of 37 million steps, more teams the merrier. So we definitely encourage folks to get out, spread the word, you know, bring folks to your team, have them start their own team. We welcome all comers. And then corporate social ambassadors as well, great opportunity for us to connect, and for lots of our partners as well as our participants to connect and really engage in that more social side of things. You know, again, since we're not getting together, we want to make sure that everybody has a chance to really embrace the community virtually. And to talk a little bit about sponsorships, because that is a big piece of, not the only piece, but a big piece of the walk is, you know, making sure that we're generating the funds to support this programming and support the kidney community. So we have a wide variety of sponsorship levels. They range from 2,500 and up. We've got some great customizable options as well with those. So sponsors can really tailor an experience and a visibility to what they're looking for. And then we also, as I mentioned, have expanded visibility. Traditionally, we are in the Bay Area, but this year with the virtual platform, we get to go broad. We get to go wide. We're worldwide this year. So not to put Todd on the spot, but I know he's got some international coworkers that are going to be joining us in the walk. And so we already got some international flavor there, but really excited to bring more of that and make sure that we're expanding the visibility of our issue, of the cause, and bringing you know, kidney health and awareness to everybody.
Okay, so I'm taking back the reins here for a little bit and just want to talk to you more. I think one of the main questions we've had is, how do we engage? How do we as a walk team, as a sponsor, what is this going to look like? It's a virtual event. We've never really done anything like this before. And I think we've seen in the virtual landscape that everything is so different. Each event is really, because we're all literally, we are creating the wheel this year with a lot of these different initiatives. And I think just wanted to kind of give you an idea of some of our incredible corporate partners and ideas and companies and teams that we've already started working with this year, and kind of explain what we think this could look like for you, so you can start kind of looking at your internal corporate culture and figuring out which way might work best for you. And we want to continue those conversations. So we'll be providing copies of these slides of today's program to you as well, so you can go back and review this information. But we also encourage you to have meetings with me, Amy, Reed, whoever is most important to you in driving your efforts forward, maybe a combination of all three, we hope, to make sure that we are working on a plan that is perfect for you. And we will do anything and everything to make that effort successful. So to start, wanted to start by talking about the traditional approach. So Satellite Healthcare over the last couple of years has been a remarkable corporate partner for us, and is a presenting partner for our kidney walks here locally in the Bay Area this year. And their efforts have largely been to do a dollar for dollar match for their employee walk teams. So their clinic teams, the amount that raises, those employee donations getting matched dollar for dollar. And they've been very, you know, it's a very traditional approach and something that they've done year over year. So they didn't really have to think too much about what that involvement might look like, but making some small changes given a virtual year, but really just thinking about what's been successful for them. The other thing that they do for us, and a lot of our dialysis clinic partners are remarkable, is that they put their collateral in their locations for us. So it's about being able to share the word about the event, hand those things out to patients and clients as they come in, and allow those folks to experience the broader community that Kidney Walk provides. Equus, and we're really excited that Leslie from Equus is on the call with us today. Equus is doing what we're calling a more transitional approach. So their national team has decided to do a broad vendor campaign, which is something that they've done for a couple of years, and just reaching out to those networks to say, this is something that we're really proud of. It's something we feel is very important, and we would really love to have your support in whatever way that can be this year. And I think where we start to see that transitional approach to this is that they're helping us gain traction in areas where we are casting that wider net this year. So we're looking at areas like our Central Valley, Sacramento, Pacific Northwest, encouraging that vendor outreach and to areas that we haven't been pushing that approach because everything has been such a hyper localized event. Well, since we can really extend the boundaries this year, really looking to see what possibilities there are in helping us to rethink those approaches. And Rob and Leslie here on the West Coast have been remarkable in working with us on that. So, and then want to talk about RELIPSA, which is really transformational. And we are very much looking at kind of taking a traditional walk team that they've done with us for years and kind of spinning it on its head and figuring out what their employee engagement is going to look like this year. So like Reed was alluding to earlier, looking at not just having walkers and employee participation here in their offices on the West Coast, but looking across the US and getting all that employee engagement from their various offices and staff across the US, but also around the world. We've had teams from Zurich and, other teams as well, and just encouraging that outreach to engage and to find new walkers and to literally leave no corner of the globe unturned as far as engagement and excitement. Also, they are working with us on customizing their employee emails and communications. And so their team works very closely with us to help customize those things, make them appropriate for their team and their staff, and then go ahead and send those out. And we're very proud of that. We are very proud of those collaborations. We know that this year is challenging. We know that there is a lot of work and a lot of changes that are being thrust onto people's desks. So we want to help in any way that is humanly possible. We want to give you the templates. We have an employee leave behind guide that we can customize for all of the various work and things that you need to do to have a successful walk team. And we will give you those items customized. We will work with you on those and try to do it in as few meetings as possible. But then also, if you look at what RELIPSA is doing, they're doing step challenges. They're looking at different ways to not just fundraise. Like, we know that fundraising is important, but we know that everybody is facing different financial issues right now. And coming up with ways for employees to feel engaged and excited, that doesn't always necessarily have to be about fundraising. And maybe it's about steps, maybe it's about working out, maybe it's about just having those connections as a staff and as a team. So kind of thinking about that and expanding on that a little bit more, we want all of our teams to think about setting some company goals. And these are just examples for you. So maybe as a company, you want to try to get to 1.5 million steps, and we can work with you to develop a plan to count those steps in office. Maybe it's pedometers, maybe it's using a certain app, having people do screenshots of their Fitbit or what have you to be able to track those. Setting a fundraising goal and, you know, being thoughtful about what that's going to be this year. I'm really excited that some of our teams, like Outset Medical, has like really gotten engaged with this. Their healthcare provider is providing a step challenge to just encourage health and well-being in the pandemic, and so they've introduced us to them as a way to, you know, expand our awareness. But they said, you know, at 15,000 for our goal isn't enough. We want to do 20 this year. I'm like, great, that's amazing. I'm so excited. And so they're really, you know, asking those US offices and looking at that level of engagement and where can they reach out to. They also have offices in Canada as well. So again, that international feeling, which is very exciting. And then looking at the number of walkers, you know, how many people do you have in the company? There's no barrier to entry. There's no cost to participate. Fundraising is not mandatory. It's, you know, obviously we ask that people fundraise, we encourage them to fundraise, but again, we know that everybody is coming from a different place, and it's about our community coming together. So, you know, really looking at those walker goals, be it family members, be it just employees, you get to pick and dictate what that's going to be, and we'll help you pull those numbers together in a way that makes sense. We also want to create challenges for your employees to get excited and engaged. So this is one challenge that we've put together, which we affectionately call the 4 out of 5, where you can encourage your employees to try to do 4 out of the 5 tasks, and they get entered to win a prize. Maybe they, you know, there's a company donation that could get made on their behalf to their personal walk page. There's all kinds of different things that you can do. Maybe they, you know, everybody that does, you know, there's drawings for gift cards, anything that you can do to kind of, again, incentivize that makes sense for your corporate culture. And then for all those type A people and those companies that are like, well, that's not enough, we clearly want to do more, we have Kidney Walk Bingo. So just when you thought it couldn't get more exciting. And the idea to get 20 out of 25. And you have the free square in the middle. So really, I mean, you've only got 19 more to go. Come on, it's very exciting. Customize this board for your company. And, you know, if there's things in there that we want to work into your corporate culture that aren't just Kidney Walk, we're happy to do that. But like one of my favorite is take a selfie wearing head to toe orange and post it to Facebook with your fundraising page, right? Like completely silly, off the wall, happy to provide people with a sequin hat, like I'm clearly wearing this morning, you know, whatever it takes to, you know, keep that engagement up. And there's only a few squares on here that actually refer to fundraising. So again, we're really being very mindful about scope and how we are connecting with our communities. So as we're all sitting here and you're thinking about what your engagement might look like this year, we just kind of want to give you some ideas as to next steps. And there'll be a follow-up email that we'll send out and be connecting with you so that we can discuss these things more and continue to build strategy with you. So the first one is to make sure that you have your team created and set a strategy meeting with our walk staff. So, you know, figure out what your plans are going to be, allow us to build those things with you and to give you the tools and resources that you need to create an effective and engaging and exciting walk team. We're going to ask you to share and engage as much as possible. Engagement is going to be a really big buzzword this year. If you guys don't already use it a lot in your own work life, we'll certainly be using it a lot as a Kidney Walk. So sharing emails, social media posts, again, that's corporate social ambassador, sharing those things on LinkedIn. You can see it in the support section here. You know, encourage others by leveraging your support. We're doing a walk team. We know the importance of advocating for kidney health. We know the impact that COVID is going to have on our kidney community, and share those things and allow others to see and see if they can find a role for themselves here as well. Again, with walk teams, sponsorship, other ways to extend that outreach. And then also just looking to have folks join our virtual networking events. I'm very proud to say that I will be the female Alex Trebek tomorrow on our in-office Jeopardy trivia night. It's going to be very exciting. There is NKF swag up for grabs for anybody who wins. And you know, looking at those, we're doing several events throughout the course of the next couple months where the topic is getting ready to walk. What is a virtual event? How do we participate? What is this going to look like? Because again, everybody's not, you don't know, and we're all figuring this out together. So if we can give people the ideas and continue to share those ideas, then which will be really exciting and I think needed by the community to be successful. And then also in that follow-up email, you will see our walk staff information. Please feel free to share that with anyone who needs it. We want to make sure that we're working with our communities in a way and as frequently as we can, and that the more we front load our engagement and our strategy sessions, that way we're ready to go the closer we get to the event. So that way everything's rolled out, we can be setting internal team kickoffs, you know, largely Zoom meetings, but doing those in a way that are COVID sensitive and socially distant, but we can still bring the enthusiasm and the excitement, and I dare say the pom-poms, because I got those too. So really making sure that we're, you know, engaging early and getting those things set up and ready to go. So please share our contact information. And Reed said it earlier, and I just want to reiterate it here. Fundraising for us this year is as important, and if not the same as fundraising. So raising that awareness, letting people know, you know, we don't know what the impact of COVID is going to be, even for those who get it but may not be hospitalized. So we're going to want to continue to get the awareness out about what are the warning signs of kidney disease, how to know if you have it. It's, you know, what do we need to do as a community to continue to advocate for people to live their best life and to have their best kidney health possible. So I just want to stop now and see, are there any questions? Is there anything that we can do? I'll leave this up for just a minute, and then I can also stop the share so we can all see each other on screen, you know, for additional questions. But is there anything that anybody would like to ask at this point, or even comments would be lovely?
Hey, Colleen, it's Todd. No, I just appreciate that, you know, we're really trying to make this work in a virtual year. And I think the biggest fear or pushback that my colleagues had when we started bringing up Kidney Walk this year is, you know, how are we going to, you know, ask people for money, you know, given the state of the world. And I think it's great to see all the other ways that you can be involved. And this year, more than ever, with COVID, with the fires, our community is so disproportionately impacted. And I think that's the real tie-in. You know, now more than ever, we need to be doing this in a big way. And so, you know, just helping people get across that hump that, you know, it's not, you don't have to ask for money and do it the same way we've always done it. There are these other creative ways. So it's just reminding people to keep an open mind, and I appreciate how you guys are coming up with new ideas, and anything I've asked you to help me with, you know, you're right there. So greatly appreciate it.
It's what we do.
Down to writing an email.
Absolutely.
How do I
Well,
ask?
that's it. You nailed it. 100%.
Thank you.
Yes, give us full access to your email. We'll send off a ton on your behalf.
You know it. Absolutely.
You know, Todd, we were on a call the other day with one of the lead from the Storm and Norman team for Satellite Healthcare, and you know, she was talking about the fact that, you know, COVID would already had them kind of in this place of having to do everything differently, and, you know, and care for patients, you know, above and beyond what they've done historically, which we all know Satellite does a fantastic job. But she said, and then you add the fires to that and people being displaced, and it doesn't change the fact that everybody, you know, they all still need dialysis and they all need their care. And so, you know, I think about these heroes that we have within our community, not just the patients, but the, you know, the physicians like Dr. Albander and the people in the clinics that are caring for our patients. You know, it's just, everybody's going above and beyond. And now even with the fires, it's, you know, compounded that. So lots of reasons to be motivated to walk this year and to inspire our community. So thank you for everybody on this call for all that you're doing. I'll button it up from there.
Hey, Colleen and Amy, this is Lindsay from Exelixis. Just want to thank you so much. You guys are always so great about generating ideas and providing, you know, your corporate sponsors with templates and just great things that we can use. It's so appreciated. And I love this year how you're, you know, also including and coordinating with the other regions. You know, for us, we have folks spread across the country, and I think it just makes it so much more impactful, and the fact that we can be really inclusive and make a bigger impact. So thank you, and looking forward to just continuing to connect and leverage all of your great materials that you have. It's going to be really great for us. Thank you.
Absolutely. And I think going forward, this is something that we're going to continue to see. I think we have done, having a virtual component, being obviously the only component in a year like this, is one thing, but we're going to now, we have raised the bar as far as event expectations, and that we're going to continue to see those elements of virtual coming into play and as we move forward. So we are asking our companies and our corporate teams to include those offices from around the US or around the world, and we are going to be able to continue to include those companies. Like, we know things have been hyper localized for a walk event, but we're going to really be able to change the landscape of what this is going to look like. And so I don't think that this is going to end this year. I think we're going to figure it out this year, and we'll be able to continue to grow those initiatives. So if people get excited and stay excited, they can continue to engage with us in this going forward, which is really exciting for us. So
Great.
Hey, Reed, you're muted.
There we go. Sorry.
There we go.
Non-traditional walkers are a great opportunity too this year, and again going forward. Obviously, with dialysis, not everybody's able to get up and go walk. You know, so in that context, we have an opportunity now to bring the walk to people who wouldn't necessarily have been able to participate due to limitations before. So this is definitely a component that expands, you know, us into the community that we serve in such a great way.
Absolutely. And Rob or Lindsay, I didn't want to put you guys on the spot during the presentation, but you know, if there's anything that you guys wanted to add, I mean, your support is so incredible to us, and we're just so grateful. And working with you guys has been phenomenal. So if there's anything you wanted to add at all, you're more than welcome. So.
Sure, I can go first. I mean, I think, you know, this is such an important collaboration for us being in the Bay Area. You know, our company is rapidly growing, and last year it was great for us to see a even bigger team involved. And so, you know, for us, we're really thinking about ways to keep employees engaged, and how do we do that, and, you know, do that in a virtual setting outside of just our typical, you know, day-to-day, and also focusing on our core mission of helping patients. And, you know, we're specifically focused on renal cell carcinoma in the cancer space, but, you know, holistically, the work that you guys are doing is just so important. And we're thinking about ways, as I'm happy you brought up the challenge bit, because we are thinking about ways to make this fun and get people moving and outside, because we know, you know, everyone can agree that it can be quite mundane and just seems a little bit like Groundhog Day, you know,
It does,
being at
and
home.
then throw the smoke in there, and it's like, what the heck are we doing?
Yeah, like the only thing we had was going outside.
Exactly.
So,
Not the good parts of Groundhog Day either.
Yeah, exactly.
Yeah, I know.
We all keep meeting Ned Ryerson over and over again.
Yeah. So for us, no, we just so appreciate the collaboration, and like I said, just all the work you do to make it really easy for us and fun to be involved involved, and our employees just so appreciate it.
Excellent. All right. Any other questions or any other comments that we want to toss in the mix? Otherwise, we can give you guys back some of your time this morning. So
I'd love to have some closing words from Dr. Albander, just because I remember when we left us back in March, we were going to raise $1 million.
We still can.
We can.
Oopsie, we need to unmute you.
I'm sorry.
No, you're fine.
Okay. Yes, I'm still optimistic. You know, this is the time to move forward and look positively. It is challenging time, but at the same time, the need is so huge. In March, we needed everything to help our patient, and now more than ever. They already have a huge burden, and now the COVID is an added burden. And it's really our duty and our responsibility to do everything possible to help the Kidney Foundation and to raise the fund and the awareness of the kidney disease for the good of all. It's really, I look at it as a positive challenge and look forward to that we'll be successful in this year more than ever. And we must try everything in our power to make this endeavor successful.
Well said. All right, Amy, let me toss it to you. Any closing words? And other than that, we'll wrap it up.
Thank you all so much. I think that it's important for all of us to get inspired and get reminded why our work is so important. So thank you for gathering all together, and thank you for letting us take this hour to try this format out. I'd like a coffee chat. Next one's going to be a happy hour on the 16th, and looking forward to having more people involved and also sharing a little bit more about the East Coast, West Coast, and what that's going to look like, and maybe creating some fun, healthy competition around that. And so just from the bottom of my heart, thank you all. This is bringing us all together. It's about community, it's about connecting, and it's about inspiring. And so thank you. And let's make this a great year. And Dr. Albander,
thank you.
I'm looking forward to connecting with you about all of the things we talked about earlier. So so thank you for being thoughtful about who we should be engaging. So that's what this is about as well. So I'll look forward to connecting with you on that.
Okay, thanks a lot.
Thank you, everybody.
Bye.
Have a great day, everybody.
Thank you.
Everybody.